In this video, I will review tirzepatide, brand name MOUNJARO. This is a anti-diabetic agent which was approved by the US FDA in 2022 for the treatment for type 2 diabetes. You will learn about its indications, recommended dosage, mechanism for action, pharmacokinetics, contraindications, and side effects. Now, let's dive into this medication in more detail. Tirzepatide, brand name MOUNJARO. This medication was approved by the US FDA on May 13, 2022, and indicated to improve glycemic control in adults with type 2 diabetes mellitus as an adjunct to diet and exercise. This is a synthetic 39 amino acid, GIP. So GIP refers to glucose-dependent insulinotropic polypeptide analog. Therefore, this medication you can see is a peptide analog. It's about 39 amino acid peptide with a lipophilic C20, which means they have a 20 carbon chain fatty acid diacid chain in the tail group here, enabling high protein binding and prolonged half-life. So given this is a long lipophilic C20 fatty acid diacid moiety, the lipophilic tail, so therefore this makes the medication more lipophilic, enabling high protein binding, so therefore with a sustained half-life. This medication is available as 2.5, 5 milligram, 7.5 milligram, 10 milligram, 12.5 milligram, or 15 milligram per 0.5 milliliter in a single dose pen or a single dose vial. Recommended dosage, starting dosage 2.5 milligram, given subcutaneously once weekly. After 4 weeks, increase the dosage to 5 milligram subcutaneous injection once weekly. Then, if needed, increase the dosage in 2.5 milligram increments after at least 4 weeks on the current dose. The maximum dosage is 15 milligram subcutaneous injection once weekly. This medication also carries a US box warning at the risk of thyroid C-cell tumors. This was based on the animal model studies, based on the animal model rat studies. So therefore the risk in humans is unknown at this point. Mechanistically, this medication works as a GIP and GLP-1 receptor agonist, so therefore it's a dual targeting agonist. Again, GIP refers to glucose-dependent insulinotropic polypeptide, and the GLP-1 refers to the glucagon-like peptide, GLP-1. By acting as a dual target agonist, this would enhance insulin secretion and sensitivity, decrease glucagon levels, and so therefore delays gastric emptying. Pharmacokinetically, absolute bioavailability is about 80% after the sub-Q injection. Tmax, that's the time to reach maximal drug concentration, is ranging from 8 hours to 72 hours. Volume of distribution at steady state is about 10.3 liter. Protein binding, 99%. Again, given this is a peptide with a lipophilic tail group, so therefore it has a high protein binding. Metabolism, this medication is metabolized by the protein lytic cleavage, again because this is a peptide analog with 39 amino acid, and so therefore it will go through the metabolism by this hydrolysis protein lytic cleavage. In addition, given this medication carries this side chain, the lipophilic, it will go through the beta oxidation of the fatty acid tail group, along with the amide hydrolysis as well. Half-life is about 5 days. So with the lipophilic profiles, for this medication, it has high protein binding and a prolonged half-life, about 5 days. So therefore, you can see if you look at the recommended dosage, and this one is administered subcutaneously once weekly because of this 5-day long half-life. Excretion in the feces and urine as metabolites. Drug-drug interactions. MOUNJARO delays gastric emptying, may impact the absorption of concomitantly taking oral medications. Just be mindful if the patient also takes some other oral medication because of the effects of MOUNJARO, so this can impact absorption of other medications as well. Contraindications. Currently, there are 2 contraindications listed on the prescribing information. One is the patient with known serious hypersensitivity to tirzepatide or to any other components. Given this is a peptide analog, so therefore you can see the serious sensitivity to tirzepatide. That's one of the contraindications. In addition, patients with the personal or family history of medullary thyroid carcinoma, or in patients with multiple endocrine neoplasia type 2. And so this the second contraindication. Adverse effects greater than or equal to 5%. Nausea, diarrhea, decreased appetite, vomiting, constipation, dyspepsia, abdominal pain. Again, this medication targeting the GLP-1 and the GIP come in the GI tract. So therefore, you can see the adverse effects, the GI related adverse effects, the gastrointestinal, that's some of the major adverse effects like nausea, diarrhea. In some cases, if a patient takes smaller meals, this can help mitigate the GI associated with the adverse effect. So in addition, you can see one of the adverse effects is depressed, it's a suppressed appetite, so therefore this can lead to weight loss. In another video, I will talk about another indication which has been approved for tirzepatide, and so that's Zepbound, because this is one of the adverse effects, decrease appetite and suppress the appetite. So therefore, this can lead to lower the weight and decrease for the weight loss. These are the key references which I have used to prepare for today's video. Most of the medication information are pretty much based on MOUNJARO prescribing information document. This document is available at the US FDA drug website along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you found this video helpful, and subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.